Where would the VPA work and would they fill a defined need? How much would the program cost and would these students be able to pay off their student loans? Are there any economic analyses that show the need for a new position and the sustainability of a new position? Who would be responsible and liable for the VPA? What federal barriers are there, if any? And are there other ideas to help Colorado animals and veterinary teams? And through that process, we learned of many barriers and concerns behind the VPA as proposed. Number one, that there was no unique skill set to this position. The overlap between a veterinarian and a registered vet tech were complete there. There was no special spot for this person. The training as proposed was severely inadequate to include this person to be able to practice veterinary medicine, including surgery. The training is mostly online with little hands-on practice and nothing like the training behind a human PA. There are no plans for accreditation by the AVMA, who does all veterinary training accreditation in our country. That includes veterinary schools and all veterinary tech programs. There will be no ability to prescribe any medications for this person due to preempting federal FDA law, which is not going to change. There were no clear liability protections for the VPA and therefore no consumer confidence protections and the potential for increased liability cost across the board. We learned that this position will not be the help that we were looking for, and especially wouldn't help those in rural and large animal settings. But we also learned of great opportunities to actual help right now, and we proceeded to work on legislation to do the following: to focus on our registered vet techs and lift up the veterinary technician specialist position, which is indeed the advanced practice veterinary technology field that we already have, to make sure that each of these positions have title protection and regulations are in place under DORA. We looked at expanding the scope of practice for our registered vet techs and VTSs to allow them to do more, to free up the veterinarians to see more patients, thereby increasing access to care right now, increasing job satisfaction for our veterinary technicians, and improving overall efficiencies in the delivery of care. We clarified and defined and expanded the use of veterinary telehealth to increase access and decrease cost right now. Those bills are in place right now as of this summer. And nationwide, things are also happening to increase class sizes, including at CSU, to produce more veterinarians faster. And the number of veterinary schools are increasing across the nation. There are 13 more coming online right now as we speak, and we are projected to meet the demand for veterinary care. So with that, I will pass it over to Dr. Jennifer Bolser.
Hi, everyone. My name is Jennifer Bolser. I'm a proud native Coloradan. I obtained my Doctor of Veterinary Medicine degree from Colorado State University 20 years ago. I'm the Chief Clinic Veterinarian at the Humane Society of Boulder Valley and the immediate past president of the Association of Shelter Veterinarians. The organizations I'm affiliated with have elected to not take a position on Prop 129. Thus, I'm speaking from the perspective of a clinically practicing small animal and shelter veterinarian and not for any organization. I work in a nonprofit open admission shelter that also has a full service small animal general practice with access to care programs. I have also been involved with multiple high quality, high volume spay neuter programs in the US and around the world. I care deeply about getting quality medical care to all animals in need, and I understand the challenges of achieving this. Shelter veterinarians are expressing deep concerns about Prop 129, which is being championed by a few organizational heads. Proponents are saying that a small group of dissenting veterinarians are trying to veto all others who support this initiative. This is a fabrication. Let's be very clear. The group of veterinary professionals expressing concern in opposition to Prop 129 is not small. It is the vast majority of the practicing veterinarians and technicians, including those working in shelters and access to care programs. We are opposed to Prop 129 because it's not good for animals. Those of us working on the front lines of access to care know that the cases that are struggling to get care in Colorado are not routine. We know that the proposed VPA will not be equipped to handle these challenging cases. We also know that the number one challenge in access to care is cost, and a VPA role will not reduce the cost of care for these cases. The slight difference in salary between the proposed inadequately trained VPA and a fully licensed, fully trained veterinarian will not shift the access to care cost challenge. All other costs, equipment, diagnostics, anesthesia, medications, will all be the same regardless if your pet sees a VPA or a veterinarian. There has been no evidence that the VPA role will decrease costs of veterinary care. Instead, pet owners will pay the same for a lesser trained individual trying to make a diagnosis and performing surgery. Proponents are also trying to suggest that veterinarians are opposed to Prop 129 because we are protecting our profits. Yet another lie. I work in a nonprofit. Ironically, when proponents were trying to sell this idea to veterinarians, we were told we should want to hire VPAs because it would increase production and increase profits. Veterinarians are against Prop 129 because we don't want animals to get inadequate care or have a delayed diagnosis or have surgery performed by someone who is not trained or prepared to handle that surgery when something goes wrong. We do not want animals to suffer with substandard care. Many are suggesting that a VPA could perform spay-neuter surgeries for shelter animals. So let's look at a spay surgery more closely. This is an abdominal procedure, a hysterectomy that also removes the ovaries. Shelter and high-quality, high-volume spay-neuter surgeons make this procedure look really simple, but I assure you it is not. They have performed hundreds of thousands of these surgeries, and even still, with all of this experience, things can still go wrong. Spay surgeries are one of the top liability issues in veterinary medicine. It makes absolutely no sense to suggest that an individual with less training should perform a procedure that is a top liability claim. All animals, including shelter animals, deserve to have surgeries performed on them by a well-trained licensed veterinarian, the person who holds the responsibility and liability for the outcome of that surgical procedure. Lowering the standard of care for shelter animals is not okay. Why do shelter animals deserve a less qualified, less trained individual to perform surgery on them? The analogy that proponents use to suggest a VPA is like a PA in the human medical field is incredibly misleading. Human PAs have much more extensive and in-person training compared to the proposed VPA. And most importantly, PAs do not perform surgery. They are not performing hysterectomies. So some have suggested that the VPA won't do surgery because surgery isn't written in the language of the proposition. It's not in the summary of the Blue Book. Well, that's because the concept of surgery is hidden in the ballot title where it indicates allowing a VPA to practice veterinary medicine. It is this legal definition of the term practice veterinary medicine that will give the VPA legal allowance to perform surgery. Pretty sneaky how the proponents hid that important issue in the title writing. One thing that is really clear, when anyone, an individual, a reporter, or an editorial board, dives into this complex issue and gets to hear the details, they understand why the vast majority of veterinary professionals are recommending a no vote on Prop 129. Thank you, and I'll turn it over to Dr. Allison Black. Dr. Black, I think you're still muted. There you go.
My name is Allison Black. I'm a staff veterinarian at the Dumb Friendly currently. Prior to that, I was at a municipal shelter in Central Texas for a few years. I'm highly concerned about Proposition 29 as well, if it were to pass. My concern is deeply personal because I know who has pushed this proposition onto the ballot, my own employer, the Dumb Friends League. I don't come forward lightly, but I cannot stand by and let Colorado voters be misled by this irresponsible ballot measure. The Dumb Friends League leadership has been advocating for this position for years, with no success working with the state's elected officials in the legislature. They have now forced the VPA concept onto the ballot for Colorado's 2024 general election in the form of Prop 129, ignoring the concerns of veterinary professionals who work directly with animals. Many people question how 200,000 signatures were obtained from the public in order to get this measure on the ballot. I believe a large amount of these signatures were acquired by pleading to DFL patrons and supporters using emotionally misleading advertising stating that animals are suffering. It is also disheartening to the organization that I believed in. An animal welfare organization has spent over $1 million to push this measure forward, utilizing resources that should instead have been used to provide quality care to our animal patients. Since joining DFL 3 years ago, I've been involved in multiple conversations about this proposal. From the beginning, staff veterinarians, including myself, were asked to provide our professional input, but it is clear our serious concerns were never truly heard. Initial meetings were open to feedback, yet when objections and questions were raised, they were quickly rejected and the discussions went nowhere. Subsequent meetings yielded no progress either. Nonetheless, without regard to our concerns and staunch opposition, DFL pushed ahead with this proposal, conveying a clear message. This is happening, so get on board. It is not just the creation of this position that alarms me. It's the complete disregard for the risks this proposition poses if passed. As somebody who performs surgical procedures on animal patients and has undergone years of training and education to do so, as Dr. Bolser said, no, I know what is at stake. No surgery is zero risk. Under the current ambiguous language of Prop 129, VPAs would be performing surgeries they aren't properly trained for. That's a gamble we cannot afford to take with Colorado's pets. A common argument in favor of this position is the comparison to a PA position or physician assistant position in human healthcare, but this is not an equivalent comparison. In fact, PAs are not legally allowed to perform independent surgeries, as the human healthcare field acknowledges that surgery should be performed by qualified doctors with appropriate training. PAs assist doctors in surgery just as current registered vet techs are trained to assist veterinarians in surgery. I hope that by coming forward and pulling back the curtain on this dangerous measure and the proponents behind it, voters will see Proposition 129 for what it truly is, a threat to quality veterinary care for pets and animals in Colorado. I urge my fellow veterinarians who have been intimidated into silence to join me in speaking out. The lives of the animals we care and all Colorado animals depend on it. And with that, I'll pass it on to Dr. Will French. Thanks.
Thanks, Dr. Black. I appreciate it, and certainly appreciate your courage in speaking up in a difficult situation. So thank you. Thank you for your words today. As Dr. Black said, my name is Dr. Will French. Appreciate you being all here today with us and joining us in this important conversation. I'm an equine veterinarian, means I work with horses. So I'm joining you today from my vet truck. I'm working in a barn full of horses, and again, appreciate the opportunity to speak with you. I'm also a past president of the Colorado Veterinary Medical Association and really wanted to share my personal concern for Prop 129, as well as a profession-wide concern with this measure. Just to underline a few of the things that have been said already, this VPA has been compared to a physician's assistant or a nurse practitioner, and that comparison is very misleading. The education that is proposed for a VPA is nowhere near the clinical number of hours that a physician's assistant receives. This proposed program would only be 3 semesters of online training, followed by 1 semester in the clinics and a final semester of internship. So again, the clinical hours that these graduates would receive is nowhere near that of a physician's assistant, and certainly nowhere near close enough to provide safe care to animals, and especially safe surgery. In my world as an equine practitioner, the most common surgery that we do on a daily basis almost is a castration. As has been mentioned in the small animal world, a castration is also the procedure that has the highest complication rate for us. The most can go wrong with the, quote, most simple procedure. So why would we allow people with less than minimal training to perform these, quote, simple procedures? It just doesn't make sense. Also wanted to highlight that this VPA has been proposed as a solution for the shortage of veterinarians in rural areas. There certainly are areas, rural areas of Colorado that are underserved by veterinarians. There's no data to suggest that these graduates would go in outsized numbers to rural areas when the economic incentives will continue to be for them to work in suburban areas. That's all besides the fact that these graduates, number one, would not be trained in large animal. The proponents at CSU have said that they would start with just small animal training. And yet the ballot initiative doesn't say that these graduates must work on only the species they're trained on. So if they are allowed to practice veterinary medicine, that means practicing on any animal for which they potentially have no training. The other rural angle that's important to highlight is that much of the need for work in rural spaces is regulatory work that's focused on disease prevention, disease identification, and food safety. All of that work has to be done through accreditation from the federal government. And these graduates would have no accreditation from the federal government and no training to identify infectious diseases that, if left unchecked or left not identified, could pose serious human health risks and risks to the safety of our food chain as well. Again, this is simply not a risk that is acceptable. And finally, the thing to underline from a rural perspective again is that these graduates would have no ability to prescribe medication. Federal law is very clear that only a veterinarian can prescribe medication. And so if farmers and ranchers need veterinarians to prescribe them medications, a VPA does them no good. So besides needing a veterinarian to supervise them, these graduates would not have the ability to really provide any meaningful care, particularly in a rural setting. Could talk about this for quite a while, and I'm sure there'll be more questions about it and some of the details of the plan. But again, we strongly urge voters to vote against this proposal and appreciate the media organizations that have come out against it as well. Thank you for your time and happy to answer any questions.
Well, thank you. Thank you to everybody for those remarks. I'm going to again say that there is a question and answer chat at the bottom of Zoom. If you would like to put your question in there, or raise your hand, I can bring you live to ask a question. And as I mentioned beforehand, I do have a couple of questions that reporters sent me before the call. So we can start with a couple of standard questions. And then if reporters want to begin asking their questions, we can move to those next. But maybe what I'll start with is a question that comes up about the Colorado State University's poll that found 70% turn away animals weekly because of their practices are overloaded. And we've talked a lot about Proposition 129 being the wrong approach to address this shortage in access. But is there a better path? Is there another path? Is there something that should be done or could be done to address this issue? Representative McCormick.
Thank you for that question. And looking at that poll, I was involved in hearing the report on that poll. As with any poll, you can guide the answers you seek via the questions you ask. And in that particular poll, asking about turning away, what was actually happening at some of those practices is patients were being diverted to other practices. They weren't being turned away without help. And a lot of that was post-pandemic, where there was such a bottleneck and slowdown during the pandemic that if we were to redo that poll and ask more detailed questions, we would find that percentage would be really different today. And so, yes, there's a lot that can be done. And that's exactly why we did the work in a collaborative way and came forth with the great pieces of legislation that were practically passed unanimously this year at the State House. So I would take issue with if that's still happening today and if truly those people were going without help. It just wasn't true, and it's not true today.
Just to underline things about that, I mean, I think a lot of that bottleneck has certainly been relieved post-pandemic. And, to be, quote, turning someone away because of true availability, it happens significantly less than it used to and very rarely. There are also issues about cost, right? And so access to care is availability and access to care is cost. This proposal has been touted as something that would decrease cost. However, the proponents admit that there is no data to suggest that this proposal would decrease cost for pet owners. As Dr. Bolser mentioned, a lot of those costs are fixed. And so the thought that this would decrease cost is there's simply no data to suggest it. there is good work that nonprofits do to allow access to care for people who can't pay full price. And that's important work, but this is not one way to fix that.
Okay, I'm going to move to another question that looks more at the master's degree program itself. The VPA certification master's program under Prop 129 would include 5 semesters focusing specifically on cats and dogs, the greatest veterinary need for many pet owners across Colorado. Proponents say VPAs would be highly trained and veterinary professionals. You say the training is insufficient. Can you explain more?
I'll jump in real quick, and then Dr. Bolser. Number one, the training that is proposed, that we were able to look at the curriculum. I'll start with the curriculum. 3 semesters online, which is problematic in itself when you're dealing with a hands-on profession, that there's so many details to doing a simple, straightforward physical exam, which is kind of the cornerstone of our practice. But the other thing is looking at the curriculum and knowing that there wasn't a collaborative effort behind making sure what was being taught, what labs, if any, which there weren't any labs when you're online, would be offered, why those courses were picked over others. And again, that's part of the accreditation process, which is not, this program is not being accredited by the AVMA. So right there, we have major problems with what is being taught and why, and is it enough? And so knowing that we're starting with kind of a program that did not go through the rigorous set of professional and expert eyes on it to get that approval, it gives me tremendous pause. Dr. Bolser?
Yeah, I think again, there's this kind of misleading information about the courses and what the courses are going to achieve. Proponents will say that individuals that go through a VPA program will have the same number of credit hours as in surgery as a veterinary student does. And the problem with that analogy is that when I was in veterinary school, yes, I took classes that I studied from books and learned a lot of, details and information that's really important. But the hands-on experience by far was the most important part of how I learned to be a practicing veterinarian and to do surgery. And that started from day one, first year, in experiences and exposures to different groups, laboratories, outside events that I was involved in. And so you're now going to take somebody that has to get enough experience in a truncated program to perform the same duties that a veterinarian is performing. And that just doesn't make sense. It doesn't add up. There is no way that that person is going to have enough exposure and training. Most of my surgical training wasn't even necessarily in a quote unquote surgical class or surgical rotation. I had a lot of surgical experience in my large animal rotations, as an example, and a lot of surgical experience in my oncology rotation. And those are not things that are necessarily explained in this VPA program or provided in the VPA program.
I'm getting one question over text here, and I'm going to open it up to all of you because it's saying there's only days left before election day. And is there one particular message that you want to make sure as a veterinarian to express to somebody that's filling in that bubble probably this weekend? They said, what's your one message that you want to make sure you get across?
Okay, I'll go. This position is not the panacea that it's being sold to the voters of Colorado. And we care deeply about the animals of our state. And if this were a fix, we would be out front leading the charge in support. But we have done the homework, we have done the deep dive, and this is a dangerous proposition. And we took measures to address the issue through our state legislature.
Anyone else want to jump in on one? Otherwise, I got one last question. So go ahead.
Yeah, I'll jump in real quick. I mean, I think Dr. McCormick underlined it. Animal safety, patient care, patient safety is not worth the risk. Why would we want someone performing difficult, dangerous procedures on animals that, potentially could go horribly wrong, and they don't have the training to deal with it? It is simply not worth the risk and is not a panacea and is a difficult, nuanced question that doesn't make sense to be solved by filling in a bubble on a ballot.
Dr. Bolser?
Yeah, I'd also add that I hope Colorado voters know, they should know, as Dr. McCormick explained, that there's been really good collaborative work to address these issues. We're elevating our veterinary technicians. I want everyone to recognize how important veterinary technicians are to our field, and that a lot of these ideas and duties that people say, well, I would see a PA for that, your veterinary technician can do. And that's what I want people to realize, that we already have the professional, licensed, highly trained individuals in our profession who will do the things and can do the things that voters are saying, I would see a PA for my vaccines or for wellness care, right? And there's more, but voters need to know we have those individuals in the profession. We've made really great changes to ensure that we are elevating and improving that profession so that they can advance and stay in this field longer. That is super important to understand. And also in combination with this is that the proponents of this are trying to mislead voters in voting for something that doesn't make sense. And everyone should question why this became a ballot initiative when we had a collaborative group working towards changes, doing this in a thoughtful, professional way. Why did the proponents abandon that collaboration to bring a ballot initiative to voters?
I have one thing to add as well. I think one of the most common arguments I see on social media is that veterinarians are greedy and that we are not in favor of this because it will affect our bottom line at the end of the day. And that is not true. I feel like as a whole, we're generally good, wholesome people, but saying that we're worried about competition and our salaries decreasing is just wholly untrue. We're worried about your pets, and that's the bottom line.
And the evidence for what Dr. Black just said is it's not just veterinarians who work at for-profit clinics that are against this. Dr. Bolser and Dr. Black, it doesn't matter how many patients they see, to how much they get paid. Most of the clinicians that I've talked to at CSU, again, it's not about the number of patients they see. CSU is not in it to make money. They're concerned about the care that would be provided by these practitioners. It is not a business decision for them. They care about the quality of medicine.
Great. We do have one question in the chat. I can read it. Dr. McCormick, I see that you've said you would like to address it, but the question is, if Proposition 129 passes, will there be opportunities for those concerned about the VPA to influence the regulation of the scope of practice, master's curriculum, and accreditation? So I'll turn it to you.
Yes, thank you. So yes, there will be opportunity, just as with any ballot initiative that pass, there are quite a few, the language that goes with this ballot initiative, as far as going straight into statute, there will be quite a few conflicting things that are already in statute, so that will need to be fixed. Also, the Board of Veterinary Medicine, their job does not include all of the details that would need to be around the guidelines and guardrails of this position. There would have to be further policy and legislation to address all of those kind of holes that go along with this proposition. So yes, there would be opportunity, but also it would be a necessity for us to continue this work at the General Assembly.
Great. I'm gonna ask one more question, then we'll go around and we can do any kind of closing remarks. Maybe hand it back to Dr. McCormick, Representative McCormick. But Dr. Black, I'm getting one question here for you, which is essentially, why now? Why, with a week to go, are you willing and able to stand up and speak out on this in the position that you're in?
I'll tell you what, I have been speaking out about this since the very beginning. I have been the most vocal veterinarian or anybody at the Dumb Friends League for the past 2 years against this. I've shown up to every meeting organized to get together to discuss this with our CEO, hoping that at the ground level, I would be able to make a difference from the beginning. But like I said earlier, it didn't really matter. I have been working with organizations to combat it from the sides and stuff, but kind of just feeling a little bit not able to express myself in the beginning, that my opinion maybe doesn't matter as much, or like I said, this is happening anyway. But I've been doing what I can at the risk of some retaliation, or lack of a better word, while trying to stay safe in my current position. So yeah, I've been doing what I can with the position that I have.
Well, thank you. Thank you for attending and participating in this press conference. I'll open it up to anyone else and certainly hand it back to Representative McCormick if you'd like to close this out.
Well, thank you, Matt. Yes, I would just like for all of you to hear that it's truly the overwhelming majority of licensed veterinarians and registered veterinary technicians in Colorado and across the nation that have been and continue to sound the alarm on this effort, that we are strongly opposed to the VPA in this proposition. And this does include nonprofits and shelters, rescues, clinicians at CSU, private practice, and large animal folks. So as I said before, if this was the answer, we would be all on board. But we, as with anyone else that has taken the effort to do a deep dive on this proposition, have found that it is not needed. It is not equivalent to a human PA, and it won't help animals, and it won't help our veterinary teams. This is a dangerous proposal, and it won't relieve our burdens. And again, we passed excellent laws that were worked on collaboratively, and we will continue to work to address access to care issues. And I just want to thank you for listening today. I know there's only a week left, and thank you to each of my colleagues for the work you do for animals and for speaking up today. I just really appreciate you being part of this effort.
Great. Well, thank you all. Thank you to the reporters for attending. And with that, we'll go ahead and end the press conference. Thank you very much.